Good afternoon, everyone, and welcome back to Conversations from Stritch. It is really wonderful to be with all of you. We've been off for about a month, and we're going to be doing the show about once a month this summer, so we're in kind of our summer mode, and really glad to be back with you and talking about a few really important things. So we're in the midst of a summer session here on campus. About a little over 2,300 students are taking classes, most of those online, but about 500 of those students are attending classes on campus, at least partially in some way. Chris, I know in addition to our students that are taking classes on campus, we do have some other students doing other activities on campus.
Yeah, one thing, hi everyone, good to be with you. One thing that is now a long tradition here at Lewis is the SHORE program. And those SHORE students, and SHORE is the Dr. James Gerard Summer Undergraduate Research Program. And they're here this summer doing collaborative research with faculty on campus. And that program offers a collaborative experience for Lewis University students from multiple disciplines to engage in undergraduate research over the summer. It's about a 10-week program. It brings students in the STEM and health sciences disciplines in connection with faculty research projects. And in addition to doing research with faculty, they discuss topics weekly as a cohort of students, such as research ethics, data analysis methods, scientific writing, resume building, all of the stuff that goes into being a professional in those disciplines. It's really exciting, and we've watched many presentations over the years that they do at the end of the term of the great projects. This summer, some of those collaborative research projects include topics that are focused on Alzheimer's, the ozone, pharmaceuticals, oceanographic maps, planktonic disease, DNA mapping, and the mapping of the spread of other diseases, including COVID-19, through mathematical modeling, vocal development, fusion core engines, and nanophotonic devices. And those are just some of the things that are going on.
It's amazing.
And, difficult for me to pronounce. We were just talking about how it would be great for our July program to have some of the faculty and students on this show and talk a little bit about the work we're doing. So we'll try to make that happen. Thanks to Dr. Kissel from the chemistry department for leading the Gerard SHORE program this summer and some previous years as well. So we'll talk to him about maybe paying us a visit over the course of at our next event.
Yeah, it's great. And just a little comment on that. You mentioned that Dr. James Gerard and his wife have put an endowment together for this. And just a little bit, Jim Gerard graduated from Lewis, I don't know exactly how many years, but let's say 35 years ago or so. And he is now a faculty out in Washington, D.C., does a lot of his own research, primarily on lead and lead in paint, and does a lot of work on the impact of that on the human body. The other group of people that is active this summer, though not on campus, is the SOAR orientation. So faculty, staff, and incoming students. So we're really pleased to welcome those new students to Lewis. We have orientation programs that run throughout the summer. We've had several of them so far. They began in May. They continue sessions throughout the summer. And they include presentations on financial aid, on billing and understanding your bill, on academic services and support. So from the CASE program here, writing and reading and math placement tests, as well as, of course, what's really important for our students is the faculty advising and registering for their first 5 classes. Most people will take 5 here at Lewis that'll start in the fall. And I want to just say that all those people, all those offices that I mentioned, everything from financial aid to all the faculty doing advising, are online with our students or making presentations to our students online to help them to feel like they're a part of Lewis. We had a group just this week of about 150 first-year students going through orientation. I'm just so grateful to the staff, the faculty, and of course the students, the parents, everybody who is kind of making this possible, still in this virtual space, to welcome our students to campus in this virtual way, get them ready so that when we get to August and September, that they are going to just hit the ground running and get started. So we wish them a great summer, and the process will continue. We have several more SOAR sessions that'll happen, and of course we have an international SOAR that happens right in the few days before classes start. Other things in end of the year kind of notes.
Yeah, well, so in addition to what's going on now, I guess it's been, 3-4 weeks since we last were here, and when we last talked, we were coming to the very end of the athletic year, and I remember the baseball team was competing in the GLVC tournament. And so there's one kind of remaining announcement we want to make, which is that our 7th-ranked women's track and field team finished 6th in the NCAA 2021 NCAA Outdoor Track and Field Championships. So we're just really, really proud of our track and field athletes and the incredible season that they had. 6th in the country, essentially, is what that means. And just a lot of great individual performances, and so congratulations to the coaching staff, to the whole athletics department for the whole season. I just will say it one more time, just extraordinary work by our athletic trainers, our coaches, and everyone connected to athletics at Lewis to move through this really unique year around and maintaining a high competitive level and really, really great academic and athletic results among that community.
Yeah, it's amazing, and I must say that there are many universities out there that never end up with a top 10 national team. They can go decades without a top 10 national team, and we had 2 teams this year that ended up in that top 10, and I would say on a regular basis we'll have 1 or 2 teams that'll finish in that top 10 nationally, which is really an amazing accomplishment. So thanks to everybody involved, as Chris already said. Tomorrow, even though it's going to be nearly 95 degrees, many of us on campus are going to be outdoors tomorrow all afternoon golfing in order to raise money for our athletes and to help fund all the great work that happens from athletic training to coaching, to, of course, athletic scholarships. So tomorrow, Friday the 11th of June, we will be at Cog Hill Country Club. There are still, I think, a few foursomes open. So if anybody is out there and wants to golf tomorrow with us, we will be on courses 1 and 3. You can pull together a foursome. You get a cart, a lunch on the course, drink coupons afterwards. There's prizes for those people that finished in first, and of course, longest drive and close to the pin, all those fun games. And I do want to say again, thankful to our athletes and our coaches. They'll all be out there tomorrow, and one of the fun things about this event is that I always find it great because our student golfers are, and I don't remember which hole they're on, but they're on one of the holes, and they'll, on the par 3, you try to beat them in terms of one of them will shoot, and whoever gets close to the pin, and you can, put some money down and see if you can get your money back. Anyway, it's very fun. So we have a lot of fun with the students and the coaches that are out there, so it'll be a great day tomorrow. Also, on the academic side, recently, national, top 10 teams, but on the academic side, some of our faculty, in combination with other administrators, have really done some amazing work this summer, and we've gotten some grants. So maybe you could talk a little bit about that.
Yeah, I want to talk about that a bit. So this is really fresh news, hot off the presses news. That we haven't really announced it yet until now. We received 2 grants this week. from from HRSA, the Health Resources and Services Administration, which is an arm of the Department of Health and Human Resources. The first grant, which is for $2.1 million over 4 years, provides funding through the HRSA Nursing Workforce Diversity Program to increase nursing education for disadvantaged students, and will address the needs of target populations in Cook, DuPage, and Will counties. The needs of the area in these 3 counties, as many people watching probably are aware, include health disparities for Black or African American and Latinx populations, a shortage of primary care providers, and a lack of representation from disadvantaged backgrounds in the nursing workforce. So the program expands and supports a nursing workforce that includes individuals from those disadvantaged groups and is equipped with tools to provide quality, culturally aligned care to underserved communities in the area. So this is so exciting for us. So what the grant really means for Lewis, serving those really, really important community needs, is the program will allow us to hire a workforce diversity coordinator in the nursing department to implement academic support for those new students who will be coming to Lewis in the nursing programs, a living learning community, and that means life in the supporting life in the residence halls, and a community around nursing students who are living on campus, and a mentoring program for first year and undeclared nursing students as they're entering into this program. So it's really, really exciting that not only for our nursing department, as well as for the impact that we're going to make in the community. And I'd just like to congratulate everyone involved, many faculty in the department and beyond worked on this grant, especially in our sponsored programs office. Bill Seiler, thank you so much. And especially Professor Daisy Sherry, who is the principal investigator for this program and Associate Dean in the College of Nursing and Health Sciences. So that's number one. The second grant from the same source, they were announced roughly the same day, is for $1.5 million for 4 years to expand the behavioral health care workforce and to address unmet needs for children, adolescents, and transitional age youth across the Chicagoland area. So that project will address workforce shortages that lead to inadequate access all across the Chicago area, and that often results in healthcare disparities among those populations, such as African American, Latinx, and low-income communities in our area. So Lewis will be able to, through this $1.5 million grant, train a total of 105 students across the 4-year period, 60 students in our Master of Social Work program, and 45 students in our Master of Science in Nursing, Psychiatric Mental Health Nurse Practitioner program. So the program will focus on integrating all of the skills related to working with child and adolescents in health, interprofessional collaboration, youth violence, telehealth, something we're really working on campus, as well as the field placement. So a special congratulations to Professor Ellen Thursby, who's the PI on that project. So really the first one focused on nursing is primarily focused on undergraduate students from those communities and returning and serving those communities and being culturally competent in order to do that. And the second one comes from a similar perspective, but a kind of broader Chicagoland area, focusing on mental health and on our graduate programs, or 2 of our graduate programs, feeding that work in the community. So very exciting, and significant dollars associated with supporting us through this work.
And it's just amazing how much progress we've made over the last 3 years. Some investments on the administrative level, but we've gotten some significant grants this year that are really going to impact the broader community. So the legacies of slavery we've talked about on this show, the telehealth grant that we got to help rural communities and underserved communities in terms of occupational therapy, speech and language pathology. We now have these 2 grants that are going to help prepare the workforce. So it really is amazing how Lewis faculty, and I guess I just want to second what you're saying, the faculty have stepped up and said, we want to take our research and our expertise and push it out into the world to make the world a better place, which is so Lasallian. And then the federal government and some foundations have said, we're going to support you in that because we believe in what you're doing. And we think you, specifically at Lewis, your faculty are competent, are the experts in this field and can make a difference.
And also maybe one other thing to
Yeah.
say about that is that it identifies Lewis. We talk a lot about how we are an institution that combines a liberal arts education with professional preparation. And really both of these grants have recognized that Lewis is excellent at that professional preparation of our students in those in nursing and social work in this case. And that allows us to make an impact in our communities because we're a trusted partner with those federal government agency, or that one agency in this case, in order to make that community impact on the workforce.
Right. No, it's really, I agree with you 100%. We, to be known for that, to have it in our mission statement, and then really have on the national level, federal agencies start really recognizing us of, yeah, you're really good at that, and so let's make Lewis the place that is pushing out these professionals into the field, and especially professionals in the field who come from diverse backgrounds and, as you say, are aware in terms of how they treat their patients as a nurse, or how they treat their patients in terms of mental health from a social work or counseling psych perspective. So for, I think, everybody, we're just grateful for that. Another congratulations on the professional staff side goes out to Chella Dufour, our Associate Vice President for Human Resources, who recently was elected President of the College and University Professional Association for Human Resources in Illinois, the Illinois chapter. And Chella does a great job for all of us. We're going to get to some stuff about vaccines in a little bit, but obviously Chella and her office is working with our employees on those kind of things. But of course, on an ongoing basis, just, helping us to bring on these new professionals, everybody in these fields that we just got done talking about. I think about Ellen, who I think started at Lewis 4 years ago, maybe 5 years ago. So at some point she needs to be onboarded, she needs to go through a hiring process, but every one of our professional staff works with HR, and we're just grateful to Chella for all of her great work, and of course now her leadership on the state level to also represent Lewis.
And then just one announcement on the impact on the scholarship front. We wanted to just congratulate 2 professors from mathematics, Dr. Marie Meyer and Amanda Harsey, who have co-authored chapters in the book called Teaching Mathematics Through Games. I think this is really interesting. The book is for college teachers, university professors teaching math, which some of us struggle with maybe when we're working on learning the thorny mathematical concepts. So the whole book is designed around helping students learn college mathematics through the use of games, and I'm talking like Risk is one of the focus games in one of their chapters that they wrote. Math for elementary education, probability, calculus, linear algebra, history of math, proof-based mathematics, all taught through kind of the engagement with games. I think that's really, really interesting, really fitting. I think we've talked about some of our math professors before this semester around doing really, innovative pedagogy in the classroom and ways of getting really difficult concepts learned by our students. So congratulations to them, and I look forward to checking out that book.
Yeah, it's really great. So the other thing that almost everybody is aware of, as I just alluded to, is that about a week ago, everybody received an email from me making the announcement that we will be, as a part of our kind of ongoing mitigation efforts in terms of COVID-19 and the broader pandemic, Lewis University is going to require students, faculty, and staff to be vaccinated prior to the start of the fall 2021 semester. we know that COVID-19 vaccines have proven to be the most effective defense against the spread of the disease, and this requirement will contribute to the overall health of our Lewis community, as well as the broader community. And I think we've seen this. Anybody who's paying attention, the global pandemic. I know, when I look at different online resources, the Latin American spread is still significant, and they don't have a significant number of their population vaccinated. So we see in the U.S. Have seen, with more than half of our adults being vaccinated, that it's really beginning to make a difference, and the numbers are down significantly. I was looking at Illinois this morning and Will County specifically, and our numbers per 100,000 are really in that, I think we're at 4 now, and it's just a really significant shift to where we were a few months ago. So we know that this will contribute in some small way, our campus, to bring an end to the pandemic and position us really, and this is really significant for us, it's going to position Lewis University to have in-person classes, co-curricular activities in person. It wasn't an easy decision, but it was certainly made, we had the foundation coming from the CDC, the Illinois Department of Public Health, the Department of Education guidance for institutions of higher learning, and the American College Health Association. All of those agencies and associations determined that what was best for college and universities were to vaccinate their campuses. And so not only are we requiring the vaccine, but we are going to make it possible to get vaccinated on campus, and more information will be going out. Dr. Sint regularly sends out a Thursday email about COVID. We will be informing the community on an ongoing basis about not only on our website can you find places to get vaccinated today if you wanted to, but also that we will have vaccination opportunities on campus as we get closer to the start of the school year. Students, faculty, and staff can report their vaccination status or request an exemption or engage the university in support in terms of reporting their vaccination status through the Lewis University app. So if you haven't downloaded the app, which would be amazing if you got through COVID without downloading the app, I can't imagine there's anybody.
Not possible.
But for new students, download the app. So if you just got done with SOAR, hopefully they told you how to download the app. And so you can download the app. You can download your status through taking a picture of your card. I did it myself the other day. The tile on the app says COVID-19 vaccination status. You click on that. It'll ask you your name, et cetera, and then you take a picture of your card. We did have a question that came in before the show started related to submitting status by a student and concerns about whether it violates HIPAA. And without getting into legalese about this, we have been requiring vaccination status, that is submission of a paper that says you are vaccinated for measles, mumps, rubella, the MMR vaccine. All of our students have had that every year. So if you are a student here, you've been required to submit your MMR vaccine. And I just want to go back to the other thing that you can do through the app is to request an exemption for religious or medical reasons. And that is something that people who have had a medical or religious exemption for the MMR have already done that. And so it's a process that we have used in the past. Yes, please.
May I add,
please.
I guess maybe I'll just reiterate that the information that people submit is secure and confidential.
Yes.
And in accordance with any federal regulations, including HIPAA and FERPA, which are the ones people refer to most often in this regard. And I just want to say we got another question. I think that's a good time to bring it up now, which is how long does it take to hear back about an exemption request? And so I don't know exactly the answer to that question. I just want to recognize that it's a question that's out there. And from speaking with our members of our hotline team who are managing exemption requests for students, I think the turnaround is fairly fast. And it may not even be a conversation, it may be a conversation. So I know that they are either processing them or contacting people or reaching out in order to have a conversation to get more information. It should not be a lengthy amount of time between when you submit it and when you do get a response.
Right, but to your point, a little bit of patience, especially on this front end, because as we made the announcement, we did get, I think probably we will have the largest number of requests for exemptions happen in this first 2 weeks after the announcement and the 2 weeks right before classes start.
True.
That would be my guess.
You're right.
So, just recognize that we are human beings, and our hotline team has worked very hard for the last 15, 16 months and will continue to work on behalf of our community. But they do have limited time in any given day, and so they'll get back to you as soon as they can. So applies to both students, employees, as we said in the email to employees. If employees are unable to meet the requirement, they can follow up with HR, have a conversation, and we will address those needs, just as Dr. Singh just said, on an individualized basis. We do have, because there are a lot of individual questions, but some of them aggregate into common questions, there is a part of the website that are the frequently asked questions. So we tried to, and we've talked to student government, we talked to staff council, we talked to faculty senate, and asked them about what questions do you think your constituents are going to ask about this vaccination requirement. And we've put up as many of the questions that we could think of or we received from students, faculty, staff, representatives, and our own thinking. So those pieces of information are there for you on the website. And we will be adding FAQs throughout the summer as we hear more from members of the community. And I just want to wrap up this section, and we may have other questions that come up later, by thanking everyone. And again, not just thanking them for their commitment to creating a healthy Lewis community, but also all that's been done to maintain a healthy Lewis community throughout the pandemic. Because we really, this has been a very long journey, and this is one more stage in that journey. It's not, we required people to wear face coverings. We required people to sit at a distance in classrooms. We went fully online for a certain period of time. All of those were a part of the response, and this vaccination requirement is just one more step on the journey of making sure that we promote the health and create a safe environment. And we've said that over and over again. Our fundamental response to this pandemic has been about making our community as safe as possible. So, but we have some, I think, very exciting news that's also coming out today, tomorrow, related to the pandemic.
Yeah, so speaking of phases and stages and journeys, we expect that tomorrow the state of Illinois is going to enter Restore Illinois Phase 5, which allows most businesses and organizations to resume normal operations with new safety guidance and procedures. So first of all, again, my thanks also for all of your efforts as a community to get us to this point in the pandemic. So our cases are down, our vaccinations are being widely distributed on campus and off, hospitalization numbers are manageable. Our vaccine requirement that we just discussed, as well as lifting of governmental restrictions and the advice from the Centers for Disease Control and the other agencies that we've talked about already giving us feedback really enable Lewis to now relax some of the current mitigation measures in place on campus. So beginning tomorrow, I'm going to go through a fairly long list of changes, and of course, as usual, my weekly email will come out this afternoon, so that will be the place where you can read it with more care. But starting tomorrow, face coverings in a few things about face coverings. So in general, our community understands the benefits of wearing face coverings. We encourage and support all members of our community who choose to wear a face covering and continue to do so through the summer into the fall. However, face coverings are no longer required to be worn when outdoors while on campus university property. In addition, those members of the community who have submitted their fully vaccinated status to the app or in the submission process that we just talked about, face coverings are not required indoors as well. So I'll say that one more time. If you have submitted vaccination documentation already or after you do not have to wear face coverings indoors. If you have not submitted your vaccination status or don't plan or are not able to fulfill that requirement, then you just simply have to wear face coverings indoors through the rest of the summer before the vaccination requirement takes into effect in the beginning of the fall. Public health guidance still recommends social distancing whenever possible. So again, face coverings may still be required of individuals attending an event or on campus participating in a university activity in certain circumstances, but we imagine those to be fairly limited circumstances. When they are required, signs will be posted and or participants will be notified of that requirement. So the general rule, no face coverings outside. If you've submitted your vaccination status, you do not need to wear them unless it's posted. Daily COVID-19 symptom screenings. I think if people are really paying attention to this is the most exciting announcement, especially students who have gone through this for 15 months. Daily symptom screenings on the Lewis University app no longer need to be done if you have submitted your vaccination status. If you have not submitted your vaccination status, you need to continue to use the app to submit your daily symptoms, either every day if you're in the residence halls or for some of those 500 students that we talked about attending some classes on campus. You need to continue to do it until the vaccination status has been submitted. All unvaccinated residential students are required to submit the screening. And now, visitors. All visitors, including contractors and visitors attending our events on campus this summer, need to complete the Lewis University Visitor Health Screening Form. This is already the case. They need to continue to do that before arriving on campus. Visitors who are not fully vaccinated must wear a face covering. Visitors who are fully vaccinated do not have to wear one and need to recognize through the process that they understand our rules. Travel. Lewis University still recommends that students and employees follow current CDC guidance on travel. Regarding other events and meetings, unless otherwise notified, face coverings are not required to be worn during outside events. During indoor events, face coverings are not necessary to be worn by those who are fully vaccinated. So I've repeated this concept in different contexts, but it's really the same concept that I've repeated probably 3 or 4 times. If you have reported your vaccination status during the summer, face coverings are optional for almost everything that you would do, and there will be a posting if you do need to wear one.
And Chris, just on this front, I mean, I think what you're saying, and these are all kind of connected to each other. The Phase 5, the guidance from national agencies, et cetera. But there are some students and some faculty who might have gotten their first dose 2 weeks ago. They're going to get their second dose in 2 weeks because they're doing Moderna. And it's at that point, they're going to go to that second one. They already have their card because they've gotten the first dose and it's signed on the first line. They're going to
Yeah.
get the second, sign on their card, final, this is valid now. And then they can go to the app, take a picture of it and submit it.
Right.
But over the next 2 weeks, as they come to campus, if they're one of these 500, if they're in the SURE program, if they're taking a class, they need to wear their mask indoors. They don't need to wear their mask outdoors. They need to submit that daily symptom check. And then 2 weeks from now, submit their form. And then for the rest of the summer, they don't need to. So just, there's, I don't think it's hard for anybody to understand, but basically as soon as you submit it, that you're fully vaccinated, these things kick into effect. And that's really what we're trying to communicate today, because tomorrow, the state of Illinois, restaurants are going to change. Going to concerts outside is going to change. All that's going to change, and we're trying to do that, but we're tying it to, we know that you're vaccinated.
Right. That's exactly right. And just a couple of other things. Our university will continue to plan classes and activities with recommended social distancing for the summer and beyond probably. Everyone is encouraged to maintain distance from others when possible. Symptoms and positive test results reporting. These changes to our mitigation efforts on campus are significant steps to returning to regular activities. But please be aware that COVID-19 is not over. If you are experiencing symptoms, receive a positive test result, regardless of your vaccination status, you must report them to the Lewis University COVID-19 hotline team, either through the app or by calling the phone number that I list in my weekly email. So I think that's it. I think we've talked through all of that, but you're right. It is it's fairly simple, but there's a lot of different kind of experiential situations, and I think having it in writing will help. It'll be on the website as well as in my email, and then I think just coming to campus and experiencing different situations is usually how most of us learn how new rules work. So,
well, and it seems to me that the main, I guess, set of ideas around this that we need to reinforce for people that you said in the very last kind of thing that you said is, we need you to report to the community if you feel really sick, and it could be COVID, if you get a positive test result throughout the summer, even if you're somewhere else. And this is partly about contact tracing, right? So this whole issue is that many people will not be wearing face coverings. Many people will have the kind of ability to hang out together and have a long lunch. But we also still need to know, because I think our COVID numbers will be very small this year as we move throughout the fall. But people will continue to get sick, and then we need to be able to trace that. So it's really important that you tell us when you feel sick, that you tell us when you tested positive, so that we can go through that class. And I guess I'll just go back to, we recognize that some people are unable to be vaccinated, which is why we have these exemptions. And those people are vulnerable, so we want to know that if somebody else on campus is sick, that we can make sure that those people know that you were in a class and you should go get tested. So it's really about this ongoing protection of our community. All along, the Flyers Promise was about our commitment to each other. We're committed to keeping each other healthy and safe throughout this pandemic, and that continues to today and will continue throughout the fall. And that's really what this is about. I don't know, any further comments? I don't think we have any.
Well, I'm thinking a little bit about looking forward to the future, the next decisions, and the next time we'll be together here on July 15th. Everything we really talked about today is forward thinking, and much of it will move through into the fall or relates to the fall, but really we'll do some more concrete planning around the fall semester, and we'll be able to talk about that on July 15th, probably with some level of specificity. We also, new questions arise all the time. And I guess we'll experience it in our lives outside of campus. Sort of how different situations play out as the vaccinations take more of a hold on the way we do things. Clearly more people are traveling and so on. got a question about theater. It reminded me that something we're hearing a lot in the news in relationship to Phase 5 and even outside of Illinois, which is that there are still decisions made by businesses like theaters, like grocery stores and so on about having unique requirements and so on. So I don't know, for example, what our theater, it probably, our plans for the theater are set through the fall probably and won't change, but we can start to imagine, and we could talk about probably more specifically in July how vaccinated people will be able to go to theater, and both on our campus as well as off our campus. And
I would say
many analogous things to that.
I would assume if we stay in Phase 5 in Illinois, and again, there could be changes to that, right? So we've said all along, this has been an up and down curve, so to speak. But it would seem like we will make those announcements as we get closer to the fall. But our assumption is that if we stay in Phase 5, that what you just mentioned about being indoors, there might be few exceptions where we say this is a masked event because there's going to be 500 people here and we need to do that. But I would say in general, we can imagine, we're not making the decision now, that the theater will be in person and vaccinated people who have submitted their vaccination status will be sitting in the theater without face coverings. And we want to repeat, we want to be a mask-friendly campus. Those people that feel that they want to wear a mask or need to wear a mask because they can't get vaccinated should feel totally comfortable on campus wearing a mask. And that's true in the theater, it's true at a basketball game, it's true in a classroom, right? So that it's going to be a mask-friendly campus, and we expect that some of our community will be wearing a mask all year because they just feel more comfortable. And that's great. We want to support that. Anything else?
I think that's all, and I think we've addressed the questions.
Sure. So we will, our next show will be on July 15th. As Dr. Sint mentioned earlier, we're hoping to get maybe a couple of our students and a couple of their faculty mentors from our SURE program to join us and talk to us about whether it's research related to mathematics or chemistry or physics or biology. There's programs going on in all those areas this summer. We're looking forward to having a chat about that. And I just hope that for each of you, our students and our employees, that given the way that the state is opening up and the ability for you to do a little bit more celebrating with some family and friends that maybe you weren't able to see for the last 14 months, that whether it's driving 45 minutes or 4 or 5 hours, that you will be able to take the time to enjoy your family and friends, to reconnect to your community in this physical world as opposed to the Zoom world, and that you will really be able to relax and come back this fall with a renewed sense of commitment to your studies or your teaching or your profession, all the ways in which we live in association and work in association on behalf of our students. So enjoy the next month, enjoy the 4th of July, so happy 4th to those that are going out to see the fireworks. We'll see you a couple weeks after the 4th of July on July 15th. Have a wonderful month and many blessings to you and your family.